Hello, we're back, and in this video lecture, we're going to be covering more things about different nervous system disorders, sleep disorders, and many other different types of nervous systems, diseases, and disorders. One of the things we see from time to time is organic sleep disorders, and these include such things as insomnia, sleep apnea, narcolepsy, and other problems with sleep. And they're different codes depending on what the disorder is. Another one that we see is Alzheimer's disease, which falls into code category G30, right? And there are different subdivisions of this under the code category of G30. This includes early onset, late onset, and there are notes to tell us to identify delirium, dementia with behavioral disturbances and without behavioral disturbances. And there's specific guidelines and brackets that you need to follow when coding these disorders. There are other different degenerative diseases, and these include Pick's disease, dementia with Lewy body, degeneration of the nervous system due to alcohol, and others. With these different types of things, you'll note that there are different things listed to tell people to code first the underlying disease. Another reason you need to always pay attention to what's in the tabular. Now we get into some fun stuff. If a patient comes in just for pain management and nothing else, use the G89 code. We would use additional factors if they're psychological factors. If the pain is exclusively psychological, we wouldn't use the G89. And you'll note that there are other different forms of pain. There is central pain syndrome, G89.0, G89.11 through 18 covers the acute pain. The chronic pain covers G89.21 through G89.29, and G89.3 is neoplasm related pain. Chronic pain syndrome is G89.4, and sequencing the G89 codes with site specific codes depends on the circumstances of admission, or in other words, the circumstances of the outpatient visit. And again, this gets into one of the things we talked about in terms of general coding guidelines. If the encounter is for pain control or pain management, as it's sometimes stated, the code from the G89 code category is sequenced first, then followed by whatever specific site of pain or underlying cause of pain. If the admission or the encounter is for a procedure aimed at treating the underlying condition, the code for that underlying condition is assigned first, and no code or category from G89 should be assigned. If the admission or encounter is for any other reason besides pain control or pain management, and a diagnosis has not been established, the coder should assign the code for the specific site of pain first, then follow it up with the code from the code category G89 for the acute or chronic pain. Now with post-operative pain or post-thoracotomy pain, we have specific codes of G89.1 or G89.2, depending on if the pain is acute or chronic. If the post-operative pain is not described or acute or chronic, the code G89.18 is the default code for the acute form. Now, our last slide here. The postoperative pain may be the principal or first listed code when the reason for the admission or the outpatient encounter is documented as a postoperative pain control visit. Postoperative pain can also be reported as a secondary diagnosis when a patient has outpatient surgery and develops an unusual amount of postoperative pain. Routine or expected postoperative pain immediately after surgery is not coded. And that's all I have for you. Come back and we'll have our last video lecture where we'll cover other different types of nervous system disorders, things like cerebral palsy and others. Bye now.